Hello and welcome. Let's talk about something so many of us have gone through. You settle into bed, you roll over onto your side, and bam, you're jolted awake by this deep, nagging ache in your hip. If that sounds familiar, then you are in the right place. We're going to break down exactly why this happens and, more importantly, what you can actually do about it, starting tonight.
Okay, so let's get right into it. This is the big question, isn't it? That either sharp or just dull, achy pain that seems to show up the second you try to get comfortable? Well, it's pretty simple, really. When you lie on your side, you're putting direct pressure on the outside of your hip. And if something in there is already a little irritated, that pressure is going to make it scream at you, loud and clear.
So, to figure out what's really going on, we have to kind of play detective here. It turns out there are two very common culprits, two main suspects that are usually behind this specific kind of nighttime pain. Let's get to know them a little better.
All right, first up is something called gluteal tendinopathy. Now, I know that sounds super complicated, but it's really just a fancy way of saying you've got irritated tendons. Just picture the strong tendons that attach your glute muscles to your hip bone. When they get strained or overworked, you end up with this nagging, deep ache right there on the side of your hip. This is a really common cause of this pain.
Okay, our second usual suspect is hip bursitis. Your hip has these tiny, little, fluid-filled sacs called bursa. You can think of them as little pillows that stop your bones and tissues from rubbing against each other. But when one of these little sacs gets inflamed, usually from too much pressure, oh man, it can cause a much sharper, more intense pain. You can probably point to the exact spot that's hurting.
So this is where it gets a little tricky. You might be thinking, well, sometimes it's a dull ache, and other times it's a sharp pain. And you'd be right. Here's the key thing to understand. These two conditions often show up to the party together. Yup, the inflammation from an angry bursa can easily irritate the tendons right next to it, and vice versa. That's why your symptoms can feel like a confusing mix of both.
All right, we've met the suspects. Now for the part you've been waiting for, your action plan. Let's dive into some simple but super effective strategies you can start using literally tonight to get some relief.
Here are some easy wins you can score right away. First, and this is the most obvious one, stop sleeping on the painful side. Try lying on your back or on your other non-painful side. And the pillow trick? This is a total game changer. Stick a pillow between your knees. This keeps your hips aligned and stops that top leg from pulling everything out of whack. And a little tip for the daytime. If you sit a lot, try really hard not to cross your legs. That position can stretch and annoy those exact same tendons.
Now, this does not mean you have to stop moving altogether. Actually, gentle movement is fantastic. You just have to be smart about it. Think about swapping out high-impact stuff like running for things that are a bit kinder to your joints. You know, like swimming or cycling. Gentle stretching can also feel amazing. But here's the #1 rule, the golden rule. Listen to your body. If something you're doing makes the pain worse, just back off. It's that simple.
And now for some absolutely fantastic news. And this is based on guidance from the American Academy of Orthopedic Surgeons. This is so important. For the huge majority of people who deal with this, the simple changes we just talked about, like tweaking your sleep position and modifying your activities, are enough to fix the problem. Surgery is very, very rarely needed.
Okay, but, and this is a big but, while self-care is incredibly powerful, it's also super important to know when it's time to call in a professional. So, let's go over the red flags, the signs that mean you should probably get that hip checked out by a doctor.
Think of this as your red flag checklist. If your pain started because of a fall or some kind of injury, that's an automatic doctor's visit. If you suddenly can't put any weight on your leg, or you literally can't move your leg or hip, that's another clear sign. Same goes for any signs of infection, like a fever, chills, or if the area is red and warm. And of course, if you have sudden, severe pain or a lot of swelling. These things are on a different level than your typical bursitis and need a proper look.
And hey, remember, seeing a doctor isn't a sign of failure. Not at all. It's actually a really smart, proactive move. Getting a real diagnosis can rule out anything more serious, it'll give you peace of mind, and it'll get you on a treatment plan, like maybe some specific physical therapy exercises that's made just for you.
So, let's bring it all home. That annoying nighttime hip pain, it's really common, it has some pretty clear causes, and most importantly, it's manageable. The whole game plan is to reduce that direct pressure, make some smart little adjustments to your daily life, and know when it's time to ask for a little help. So I'm going to leave you with this question. Just think about it for a second. Based on everything we just covered, what is the one small change you can make tonight? Is it grabbing that extra pillow? Is it deciding you're going to try sleeping on your back? Your path to relief really does start with that one simple first step. Thanks so much for joining me.